Welcome to Balanced Body Podcast. My name is Dr. Brent Anderson, physical therapist with Pulsar Physical Therapy and Pilates in Miami. And I often get asked the question of people wanting to treat scoliosis. Well, one thing I always like to tell people is scoliosis is more prevalent than non-scoliosis. So the truth of it is we go around, the number of really perfect spines that I've seen in my life, I could probably count on both hands, where the number of people I've seen with some kind of deviation is great. Scoliosis itself, there are different grades of scoliosis, and it can be severe and be very problematic, but most of the time it's not problematic and it's not severe. I tend to use somewhere around 25 to 30 degrees of what they would call an angle in scoliosis as sort of the cutoff point of where I start getting a little more concerned and making sure that we take the next steps. When we work with young children, particularly in their 10 to 14, 15-year-old girls, who have been identified and diagnosed with scoliosis, particularly a rotoscoliosis and an idiopathic scoliosis. Idiopathic coming from the word idiot, meaning we just don't know what causes it. Idiopathic scoliosis often manifests in what we call an S-curve or a reverse S-curve. The BAC disc, BAC disc, designed by Jean-Claude West and manufactured by Balanced Body, have been a godsend in the ability for us to give home exercises to our young patients who are trying to do corrective exercises for their Pilates or for their scoliosis. One of the things I need to make very clear here is, again, we're not always looking for correction as much as we're looking for function. So here these are corrective exercises, but do not let this be the only thing that you do with patients who have scoliosis. Make sure that they have a well-rounded Pilates program. I mean, Pilates is beautiful for scoliosis. So let's take a look at this, and let's assume that Jamie has an S-curve scoliosis. So from the top, what that might look like would be coming from the shoulder. She would have a curve here in the thoracic going towards the left, the concavity, and the concavity going towards the right in the lumbar spine. So what I'm going to ask her to do is she's laying on top of these two rotating discs that are padded, and her feet are on top of some soft balls that will allow her legs to migrate as I ask her to move her spine. And in order to open up the convexity of the lumbar, I'm going to have her reach her left leg down and away. So the rotation of the pelvis in the coronal plane actually opens up the spine on this side and allows that lengthening to take place. And return. And reach left again. And return. And reach left again. And relax. Now the thoracic curve I mentioned comes towards me this way. So now she can bring her hands up. I'm going to have her side bend to the left. Again, opening up that curve. So side bend to the left and return. Side bend to the left. Now I can have her do both at the same time, reaching the left leg down and side bending to the left, which is putting a corrective force into the spine to resemble something closer to what we would refer to as normal. Okay? Great. Now I want to bring you up into hands and knees. One of the things we learned from research is that restoring the sagittal curve also decreases the extent of rotational scoliosis. This falls into line with Fryette's law. Where movement is taken up, there is less slack in other directions or other planes of movement. So in this position, what I want to do is I want to restore as much of the kyphosis as I can in her thoracic spine. Yeah. And then to give a little bit of extension in the lumbar spine. And now we're still assuming the same exact curve of the spine. So we're assuming this S curve. If we want to open up the lumbar curve, we're going to have her take her feet to the right, yeah, and come back. And again, repeat that, just to the right, opening up that lumbar curve. And then if I want to open up the S curve on top, I can have her go to the left with her arms and her head. And back to center. And again, maintaining that, yep, there you go, good, to the left and back to center. These are two basic exercises with the back disc that are very friendly and able to teach a lot of proprioception to a person that has or has been diagnosed with scoliosis. So laying on their back, reversing the curve as a corrective. When they come on their hands and knees, the same thing, but remember that we need to restore that sagittal curve. This is Brent Anderson bringing you a couple tips for working with patients with scoliosis with another Balanced Body podcast. Look forward to seeing you in the future.